Welcome back. In this video, we are going to discuss about urethral caruncle. Objectives of this session are definition, pathogenesis, clinical features, differential diagnosis, and treatment. Before understanding urethral caruncle, you need to know the anatomy. This is the external genitalia, this is the vaginal opening, and this is the urethral opening. We have the urethra here, and this is the external urethral meatus, and posteriorly we have the vagina. So we have, this is the clitoris, and below the clitoris there is an urethral opening. What is urethral caruncle? It is a benign lesion of the urethra, clinically characterized by a pedunculated reddish looking mass protruding out of the external urethral meatus. So guys, you can see the external urethral meatus here, and this caruncle is a reddish looking mass. It is pedunculated. You can see it is being like this, like a pedunculated mass. It is hanging like a pedicle. Okay, it is a pedunculated reddish looking mass extending out from the external urethral meatus. Pathogenesis. How does this caruncle occur? It is presumably the infective in origin. It is because of the infection, and it is usually confined in the postmenopausal women. So you see this caruncle more often in the postmenopausal women. It is single and it arises from the posterior wall of the urethra. Okay. The naked eye appearance, the size of the caruncle is small. It is usually not exceeding 0.5 centimeter. It looks reddish in color. So you see this caruncle, the diameter of this caruncle is not exceeding 0.5 centimeters. It is less than 0.5 centimeters. Microscopic appearance. It consists of the vascularized granulation tissue, and this vascularized granulation tissue will be covered by the transitional or stratified squamous epithelium. You can see the granulation tissue covered with the stratified squamous epithelium. You can see the stratified squamous epithelium lining the granulation tissue. Three types are described. We have granulomatous caruncle, angiomatous, and papillomatous depending upon the histological appearance. The clinical features, like we saw, the patient will be usually in the postmenopausal period. Symptoms, if a patient is having caruncle, she will complain with the symptoms of irregular bleeding per vaginum. The urinary complaints such as painful micturition. So we have the caruncle situated in the external urethral meatus. So the urine is going to be very painful. There is dysuria, frequency, and also the retention of the urine occurs because it is blocking the pathway for the flow of urine. And also dyspareunia, that is painful sexual intercourse. Moving on to the signs. A small, angry, red-looking, P-shaped mass protruding out of external urethral meatus. So guys, here they're saying that urethral caruncle is P-shaped. It is like a P-shaped mass which is less than 0.5 centimeters in its diameter and protruding from the external urethral meatus. It is very tender, very painful, and on the examination, on touching it, it is going to bleed. Differential diagnosis. The lesion will be oftenly confused with the prolapse of the urethral mucosa and also the urethral malignancy. So here you can see the urethral caruncle, and this is the prolapse of the urethral mucosa. So how can we differentiate? This is usually arising from the posterior urethral valve, and this prolapse is occurring from the entire part. Okay, this will be less than 0.5 centimeters. The prolapse can be huge as well. Moving on to the treatment, the excision biopsy is the definitive surgery. So we excise this caruncle. The raw area after excision will be sutured or cauterized. The continuous bladder drainage will be required for a few days following the surgery. Thank you. With this we come to an end of urethral caruncle. If you like the video, hit the like button and subscribe.